Welcome to Clinical Conversations at High Noon with the Green Nurses at Holistic Caring Network, where we bring hope and inspiration for growth and healing. We are truly here to change the dialogue and stigma around what it means to feel good and be high. Hence the H for hope, I for inspiration, G for growth, and H for healing. And before we get started, we're going to pop on a little video about what we do in the cannabis spaces as nurses.
Change the paradigm of healthcare.
The Green Nurse is a holistic cannabis nurse that teaches on the endocannabinoid system and the safe utilization of cannabis and other progressive tools to help people reach a better quality of life.
I'm the founder of Holistic Caring. We're based here in California, and we do educational programs and case management for patients on how to use cannabis therapeutically as a medicine.
We're also here to decrease stigma around what it means to feel good and be high, hence the H for hope, I for inspiration, G for growth, and H for healing.
As the founder of Holistic Caring, I basically oversee the whole ship, and what we're doing is progressive education.
Cannabis actually supports all 11 organ systems, our immune system, and all the neurotransmitter signaling systems that give messages to tell our body to either do something or not do something. Because the plant was prohibited, it prevented health professionals, doctors and nurses from learning about cannabis as medicine.
I want to change the paradigm of healthcare and us paving the way into a new vanguard of medicine.
It's about education, it's about empowerment, it's about teaching people how to feel good, bridging the gap from what they're not getting from traditional medicine, utilizing different plant medicines, adaptogens, tips, tricks, hugs, and nugs of information to support and nourish the most important system in our body.
It's a lot of soul work, a lot of love, a lot of discipline, and meditation. I'm using my life work as a testimony to others to learn how they can be their own hero and then go help heal the world.
And we are, as nurses, the game changers.
All right, there we have it. Welcome to another monthly clinical conversation. My name is Sherry Mack, and I'm the Vice President of Nursing at Holistic Caring and the Green Nurse. I am a cannabis nurse, patient advocate, and a very passionate activist and podcaster here to change the dialogue in stigma around what it means to feel good and change the paradigm of healthcare with my business partner here, who I'd like to introduce, Miss Elizabeth Mack. Business partner, co-host for our monthly clinical conversations. She's the CEO and founder of Holistic Caring Network. And I just want to give her a big congratulations because Elizabeth just won Cannabis Educator of the Year for the American Cannabis Nurses Association. So very, very, very exciting. And her keynote was on building a global cannabis clinic, a global CBD clinic for nurses, and how that happened. So her keynote was on that, and it was absolutely amazing.
It was a beautiful conference.
It was a beautiful conference. But here we're going to talk about men's health. But before we get into men's health, Elizabeth and I talk about the 4 Ds and the 4 Ps. Yeah. And I'm going to let Elizabeth tell you what those are.
Well, when we say we bridge the gap between conventional and cannabis care, we have to talk about the 4 Ds, the disconnect between the shops, the doctors, the patients, and really the communication that needs to be there in that system. Distrust of the system. Who are these people that are working in cannabis? And can I trust them? Can I trust the products? What are these products? Disorganization. We have 38 legal states now and no federal system. So we have a patchwork of laws that we help patients understand. And then dosing. Clinical guidance is needed to really help people optimize this option. So we bring in the 4 Ps. The 4 Ps are process and professionalism and products that are vetted and patients that have personalized care. So we literally build that patient-centered care around the patients, and we give them what they're not getting from conventional care.
There you go. There you go, everyone. So June is Men's Health Awareness Month. Pride Month, and Father's Day is on Sunday, June 18th. And what we do have is a special on all of our programs with code June25. We've been updating programs. We actually have a new program that's going to be launching in the next month on endocannabinoid dome care, including psychedelics.
People are looking for information on psychedelics, and we're going to bring it to them. And we've got about 250 slides that we're working on, just polishing them up, and going to record that in the next few weeks and get that launched in sometime in July.
Yep.
Yeah.
So here we go for today's clinical conversation. So men's health, wellness, fertility, libido, and the ABCs of CBD. But before we get started, who do we want to give a tribute to?
Raphael Mechoulam. He is the Israeli scientist that really brought us into cannabinoid science and understanding, published over 350 studies. He is the gentleman who isolated and synthesized CBD and THC in Israel back in the 60s, 1964. And worked for 40, 50 years in this field until he passed in March of just this year at 92. And he was just the sweetest gentleman that you'd ever want to meet, and really got so many people excited about cannabis science and understanding the endocannabinoid system, the most important system in the body that regulates everything else. So we love him.
We do. And if it wasn't for him, I know I wouldn't be here today, right? That big bad THC molecule that everyone's afraid of saved my life. So here we go. Dear men,
we care.
We care, right? Did you guys know that men die at a higher rate than women for most every single cause? Heart disease, stroke, cancer, COPD, accidents, liver and kidney failure, diabetes, and suicide. So how do we change that? We can change that with education on how to stay healthy by doing what? Modulating the endocannabinoid system and the endocannabinoid dome. So Elizabeth and I have said this, Elizabeth has presented on this over and over. The drivers of true health care lie outside the conventional system and are modifiable by us as people, professionals, patients, by what we do or don't do. And this is about caring for the endocannabinoid system and the endocannabinoid dome.
And really, we want to support that with men's health, women's health, all of our health by the 4 pillars of health, which are nutrition and exercise and movement and connection and socialization and right work and rest and prioritizing sleep. And how do we do that? We put self-love on top. And we lead from there so that we have the agency to take better care of ourselves. And men need to do this. You know, I lost my dad at 62. He died of lung cancer, and I was only 24 years old. So I've been without a dad for 33 years, and I want to implore all dads to take better care of yourself and just love yourself, love your family, and love your body. This is the only one you get.
It's the only body that you get. So before we get into some of the details about fertility, libido, you know, sperm count, testosterone, all of those juicy details that we want to educate on because it's important, but we want you to understand the endocannabinoid system first. Yeah. So the endocannabinoid system, this is the green nurse's umbrella. It's a beautiful, colorful rainbow umbrella that has many significance to it. But the reason why I use the umbrella to teach on the endocannabinoid system is just because it makes sense. It shows the interconnectedness of all of our different systems. So the endocannabinoid system is the largest neurotransmitter signaling system. It regulates all 11 organ systems, our immune system, and all the neurotransmitters that give messages to tell your body to do something or stop doing something. So just as serotonin signaling, dopamine signaling, opioid signaling. So the endocannabinoid system is a sensor. It reacts to stress or change, releasing are endocannabinoids that we make upon demand to turn up or down cell signaling, correcting messages between all cells and systems. So I just want you to imagine, if you can see the umbrella here, these are all of your different organ systems, and this shows the interconnectedness. We have cannabinoid receptors, CB1 and CB2 receptors on all of the cell surfaces of all of our cells. So it's very, very interesting how this works, and also at the neurotransmitter signaling junction sites that connect up to these different systems. And so we produce internal endogenous cannabinoids upon demand to shower on our umbrella to give messages for the body to do something or not do something. So what we're teaching about a little bit more, and it'll kind of make sense, is we need to think about the entire body. So we're talking about the endocannabinoid dome, which is the larger environment that interacts with the endocannabinoid system, which is the receptors, the enzymes, and the endocannabinoids that we make, as well as other constituents in our body. So we have the lipid dome, right? Lipids are fats. Fats support our cells.
The building blocks.
It's the skin of our cells. And we need essential fatty acids for us to be able to create these endocannabinoids upon demand. So the lipid dome is important. The microbiome is just as important. The microbiome is its own universe.
Yep.
Right. And so we need to be able to take care of it. We have more
good bugs, bad bugs.
Good bug. Who's living in your house? The good bugs or the bad bugs? Right. And then we also talk about mind-body tools, right? The endocannabinoid system signals the fight or flight response and the relaxation response. Guess where we function best? The relaxation response. Cannabis can help us get into the relaxation response, but so can other health and wellness lifestyle. So that's what we do, is we teach lifestyle as medicine.
We make it fun.
We do make it fun. So it, the endocannabinoid system is very, very powerful, and it's modulated by multiple different things. But now we're going to talk about how and why cannabis works with this system.
Yeah. So how cannabis works. So Sherry talked about the three components to the endocannabinoid system: the receptors, the endocannabinoids, and the enzymes that create and degrade them. But we have other cannabinoids that we can talk about. So phytocannabinoids are the molecules that are found in the plant, the cannabis plant, the hemp plants. And these phytonutrients actually mimic our endocannabinoids and plug into those same receptors. So guess what? They're able to fulfill that pharmacology when we need to nudge the endocannabinoid system back into homeostasis and balance. And so we can do that in three different ways: the endocannabinoids that we make ourselves, the phytocannabinoids that we can supplement from the plant, and then of course pharmaceutical companies have made synthetic cannabinoids. They have Marinol, Dronabinol, Sesamet, Epidiolex, which is purified CBD, and all of them plug into those receptors. And we have more of these receptors in our body than any other signaling system, because that's how prevalent it is. It's literally on all of our cell membranes. And that's why the endocannabinoid system can modulate all of those other systems. So anyway, and then you can see THC plugging into the same nerve cell receptor, that CB1 receptor that anandamide would plug into naturally. If we're not making our own, THC can plug into there and bring us back to balance. And it really is almost that simple. When we talk about mimicking and bringing us back to balance, think about vitamin D, right? If we're deficient, we can take some as a supplement, raise our levels. We're going to sleep better. Our immune function is going to be better. Our inflammation is going to be better just from supplementing with vitamin D, which is another thing, as well as magnesium, that we can talk about. But good things can happen from supplementation, and it's as normal as you could imagine with just about any other supplements.
Yeah, I just love too that we have more CB1 and CB2 receptors in our body than any other receptors that are providing that feedback to correct signaling. Very, very powerful. What I like too is we make them upon demand as needed. Yeah. It's the intelligence of our body. So here's another example of the endocannabinoid system. So eat, sleep, relax, forget, protect. Vincent DiMarzo. Amazing. So what I really like about this slide, and what's really interesting about the endocannabinoid system that makes it very unique and different, is generally neurotransmitter signaling systems flow one way, from presynaptic to postsynaptic neuron. So the endocannabinoid system is a little bit different. It senses what the presynaptic neuron needs and releases these endocannabinoids to gently nudge to create that message, to give a message to correct the signaling so our body can stay in balance. Very, very powerful.
I call this slide the traffic cops, right?
Yeah.
So the traffic cops are released at the scene of an injury or stress or an accident. There's something not right. They're cleaning things up, patrolling, making sure there's order and restoration. How do we get back to good, right? That's what the endocannabinoid system's always doing: listening, sensing, and delivering that feedback as needed on demand.
So what happens if we don't produce enough of our own internal endogenous cannabinoids? If we don't make enough of our own anandamide, right, and 2-AG that mimic, well, we need to supplement, right? So if this is the most important system in our body, it just makes sense that we're going to treat it as the most important body system in our body. So endocannabinoid deficiency. So endocannabinoid deficiency, we look at a lot of different things. If we're not producing enough of our own internal endogenous cannabinoids upon demand, or enzymes that might be breaking down the endocannabinoids too fast, or we may have an overabundance of receptors or an underabundance of receptors, depending upon what's going on in our body. So it's a complete balance. Endocannabinoid deficiency. So when we're teaching, right, I'll be like, oh yeah, we got an endocannabinoid system. People will be like, well, if we have an endocannabinoid system and we make molecules in our body like the plant, then why do we need the plant? Well, you need the plant because your body's not in balance. If your umbrella isn't going up and down nicely, if you're on multiple pharmaceuticals, if you're having a ton of side effects, symptoms, and you're in disease, then you probably have an endocannabinoid deficiency. The causes of an endocannabinoid deficiency, age and genetics plays a huge part in it. Lifestyle is probably the biggest impact on how healthy our endocannabinoid system is or isn't. And this is critical and important because when we introduce these other activities, it's going to make your cannabis work better.
And this is all lifestyle on this side, isn't it?
Yeah. Yeah. So you can see, right? Age, genetics. The big thing that we like to talk about specifically is diet, right? Fast food, fried food, fake food, artificial flavors, artificial coloring, trans fat, hydrogenated oils, high fructose corn syrup,
Processed foods,
sugar. All of it's the fake food.
Yeah, your body makes all of these fatty acid neurotransmitters and endocannabinoids from good whole foods. We're supposed to get all of the nutrients we need from the foods, but who's eating all of that iron and broccoli and good things, the good whole foods, the vegetables and salads and lean proteins and good fish like salmon and etc. Right?
Yep. And so all of the other things that can contribute to it, chronic stress, poor sleep, smoking cigarettes, which we're going to talk about in a minute when we're talking about sexuality and erectile dysfunction, chronic alcohol use. Alcohol is toxic to all 11 organ systems in our immune system. Polypharmacy, if you're on a lot of pharmaceuticals, it causes a drug nutrient depletion, right? We need micronutrients to fuel our cells. Diminished social interactions and lack in touch and laughter. So as you can see on the right-hand side, there are all of these different things that can support and modulate the endocannabinoid system and the endocannabinoid dome. Cannabis and hemp is one of them, and it's at the bottom. But oftentimes patients will come to us and they've exhausted all of these other modalities, and they'll come to us and they'll say, nothing works. I've tried everything. And this is where introducing plant phytobotanical nutrients could be appropriate to help kickstart that system.
And it really is the master key. When we introduce this to patients and they have exhausted all of these other options of lifestyle medicine, we give them the key to turn everything on. And once you get some phytonutrients in for a few days or a couple of weeks, they start to feel better. So don't give up hope. We can get you through this menu and give you a better life.
Absolutely. So conditions, right? So this is just another example that shows how cannabis works in the body. It's the maestro to the symphony that is every physiological system in the human body. And its role is to keep us healthy. I love how you described it too. When you're looking at a symphony, you have a violinist, right? And the violinist is playing and he's doing an amazing. There you go. That's THC.
And well, a soloist, right? We go to Symphony Hall and you want to hear that cello and the piano, etc. But when the orchestra is harmonizing and synergizing their music together, it's just absolutely breathtaking, right? And that's the endocannabinoid system working in totality, as opposed to just something that we send in the pharmacology in regular pharmaceuticals, where it's a single molecule and it's just targeting one little receptor to have a specific function. The endocannabinoid system, when we nourish it with a good whole plant full spectrum medicine, botanical supplements, then we can put a blanket on our entire body.
Yeah, for sure.
Yeah.
Good stuff. So here we go. Yeah. Dear men, the benefits of modulating your endocannabinoid system and endocannabinoid dome with cannabis products and lifestyle can do the following, right? Physical, balances the nervous system, immune function, stress hormones, reduces pain, can decrease neuropathy, muscle tension, increases mobility by reducing pain, increases energy by reducing pain. So if you have those things, and the mental benefits,
it can improve your quality of sleep, helping to restore those circadian rhythms, helping you relax and feel that sense of calm and well-being, decrease fatigue, decrease anxiety, decrease isolation, and help you be able to get out and connect with people, having better energy and improving resilience for that better sense of empowerment that I can do this. And then that goes into, everything else that we talk about in promoting healthy lifestyle. Because once you feel better, you can start doing more things to help take better care of yourself, to even feel better.
Yep. So here we go. Sperm, fertility, woo! Right. This is the juicy slide.
Yeah.
So, the bottom line, too much THC for anyone is bad. That's all I'm going to say. Okay. The plant makes THC, we make anandamide. The molecular structure is very, very similar, does the same thing, but the THC molecule is 10 times stronger than our anandamide molecule. And when we're creating these endocannabinoids upon demand, we're creating the anandamide upon demand to nudge the cell. And so when we take THC, it plugs in just a little bit.
For like 8 hours as opposed to a microsecond.
Right, exactly.
It's a big difference.
So the interesting thing about here, what we have is we have CB1 and CB2 receptors are found through the male reproductive system on the penis, testes, prostate, and the spermatozoa. So when we think about CB1 and CB2 receptors, right, they're docking stations in the brain, they're receptors in the brain and the central nervous system. We have CB2 receptors in the immune system and our organs. And so the endocannabinoid system influences endocrine and hormonal function in the brain and other glands of both men and women. Remember, if we go back to the umbrella, right, the reproductive system was one of the spokes of the umbrella. And so it makes sense. So anandamide is that molecule that we make that mimics THC. They activate these CB1 and CB2 receptors throughout the body to provide a physiological response. And studies have shown that too much THC can decrease motility of sperm. And here's the research to support it.
Yeah. And so what's motility, right? How fast they can swim and to be vital, right? So preclinical trials have showed us that male infertility can be subject to investigation. And some of the known factors include endocrine dysfunction, sexually transmitted diseases, traumatic injuries to the testes, if you've had an accident, UTI, urinary tract infections, exposure to environmental toxins, ionizing radiation, heavy metals, pesticides, and then, of course, chronic medical conditions can absolutely affect sexuality and production of sperm. Significant or chronic stress as you're dealing with life changes. Sometimes that can harm things. And then, of course, pharmaceuticals. They can influence everything in our body when we put drugs into us. And so we want to look at what we're taking, especially chemotherapies if somebody's treating cancer, and then sperm transport disorders, genetic disorders, or sperm abnormalities. So there's a lot of things that can cause this, as well as depression, chronic use of alcohol, tobacco, and recreational drugs like methamphetamine and steroids. Steroids can also impact men's health and fertility. So based on a research review, if you're a male who is using recreational cannabis and you're unsuccessful at conceiving a baby, then you might want to try quitting smoking or using it. And really, it is inhalation more than a tincture. A daily tincture of CBD is a very different thing. And Sherry can talk about that.
Yeah. So there's other things that you can consume. It's just too much THC is not good for anyone. And the bottom line, when we take in too much THC, your body goes, ooh, that's a little too much. So your receptors start to hide.
They downregulate.
They downregulate.
They hide.
And the amount of anandamide that you're making on your own starts to decrease. So really, really important to be able to balance this out appropriately. So here we go. Erectile dysfunction and sexual performance. So frequent cannabis smoking, this is inhalation, may affect testosterone. So there's conflicting research. It conflicts whether it's negative. So erectile dysfunction may be worrisome if you take too much. However, we know that cannabis is biphasic in nature, meaning that low doses do one thing and high doses do something else. So low doses might be more stimulating and energizing, waking up the senses, while larger doses can suppress the nervous system and do what? Shut things down. Right. So sexual performance may benefit from low doses of THC to help with arousal, though large doses may inhibit orgasm in some men. So doctors that treat erectile dysfunction tend to caution their patients more about the harms of tobacco and alcohol on sex as opposed to cannabis.
Yeah, and why is that? So tobacco is shrinking the vessels, causing vasoconstriction, not opening up the blood flow, which is the opposite, which is what Viagra wants to do. Alcohol, of course, is toxic to our body and really harms the system. So, you know, having a few drinks before bed is also not going to be the best thing that you want to do.
Oh, yeah.
But a puff or two could actually enhance sexual performance, and we know that. And I think we're going to talk aphrodisiac. There you go.
Here we go. Aphrodisiac. Okay, interesting. So libido description. So a libido means asexual, not really interested in sex, or reduced frequency of sex, or complete absence of normal desire. So conventional medicine suggests that the following reasons for low libido, right? Pathological sexual desire disorders, erectile dysfunction, impotence, frigidity in women, female sexual arousal disorder, orgasm disorder, or simply sexual dysfunction. So physical causes of low libido may include pain, right? Adverse effects of pharmaceuticals, people that have chronic conditions, specifically antidepressants, drug abuse, smoking, hormonal imbalances, number of chronic medical conditions, specifically those of the central nervous system, and those that have low blood flow circulation disorders, surgeries, particularly in the region of the pelvis, radiation therapy and chemotherapy can 100% decrease someone's libido. So preclinical trials.
And I mean, just even thinking about some of, you know, the frigidity and impotence and some of the issues that we were just discussing, cannabinoids can help opening up and restoring circulation, and then also assuaging some fear, opening up connection, helping couples to unite a little bit stronger, and to maybe have some conversations that they needed to have before they get back in bed. And so there's so many different ways. But endocannabinoids, anandamide in the nucleus accumbens, amplifies sensory pleasure. And 2-AG, our other endocannabinoid, plays a role in the rewarding consequences of sexual arousal and orgasm. So when you're having that oxytocin, you know, maybe endocannabinoids are helping promote that. There's a large-scale meta-analysis that indicated that the use of cannabis associated with increased sexual frequency, and it didn't appear to impair sexual function. So people that were cannabis users, not heavy, but just normal, did have more sex. And they found that it positively impacts libido. THC can induce euphoria and bliss. We know that. Ananda, Sanskrit for bliss. CBD can produce expansive, effectual mood changes and basically relax us and calm us down. There was an overall positive rating in Canakis on these clinical findings that it was 100% clinical results, and 83% of those were positive. So people are getting affected by cannabinoids. And of course, we can use a chemotype 1, 2, or 3. Chemotype 1 is high THC. Chemotype 2 is a balanced CBD THC. Chemotype 3 is high CBD, which is where you might want to start. Just get your circulation going, get your HPA axis calmed down, and get you back into that rest and relaxation response first with some chemotype 3, and then we can keep going. But anyway, in the Stanford survey, 24,000 people were using cannabis, and they did have more sex. So cannabis has been used as an aphrodisiac for thousands of years. And today we have just people that want to try, right? If you've exhausted other options, why not try a puff, pass?
Puff, puff, pass. And you know what? And if you don't want to puff, you can always start. We can puff on CBD. Yeah. If you wanted to start off somewhere, you can always start off with CBD. So CBD is great. So we support this a lot of times. This is where patients come and this is where they want to start. And so we educate on that. CBD is a cannabinoid. And a cannabinoid is something that interacts with the endocannabinoid system. We already talked about there's phytocannabinoids the plant makes, endocannabinoids that we make, and synthetic cannabinoids that the pharmaceutical company makes. So the cannabis CBD is found in the cannabis plant that has more than 0.3% THC. CBD can also be found in the hemp plant that has less than 0.3% THC. So the difference between cannabis and hemp is a lab result. Really, really important for people to know. There's many different product types out on the market, and we're going to talk about those. But then there's the molecules. So when we see this molecule here, the CBD molecule, that's the CBD isolate. It's a single molecule, very similar to a pharmaceutical. Broad spectrum CBD is the whole plant, all of the molecules, except for the THC has been extracted. And then we have full spectrum CBD, which is whole plant, including a minor amount of THC, 0.3% THC or less.
And they do that. They remove the THC so that people that are subject to drug testing are able to take cannabinoids, to take CBD without fear of losing their position.
Absolutely. And another important thing for people that are new out there is that the government did have a patent on CBD back in 2003, 20 years ago. US Patent 6630507. Cannabinoids are found to protect cells from damage and decay following ischemic results such as stroke and trauma. Cannabinoids may treat neurodegenerative diseases such as Parkinson's, Alzheimer's, and dementia.
Powerful stuff.
Powerful stuff.
Mm-hmm.
There you go.
So, and speaking of power, the power couple. So, yeah, we don't use just CBD or just THC. When medical patients come and say, I don't want to get high, I don't want to smoke anything, we assuage their fears and say, we're going to talk about the whole plant and bring it to you as you need. And we're going to personalize this. But CBD is really where we started. It activates over 70 targets in the body. It is the most abundant non-impairing cannabinoid in the plant. And it benefits all of our 11 organ systems and our entire ECS. As well as many other receptor targets throughout our body, other neurotransmitter signaling systems. CBD modulates THC and softens the effects so that when we do bring THC on board, it's not going to impair as much or cause psychoactive activity that might scare somebody that is new. And then we can use CBD and THC in ratios to introduce this, like a 2-to-1 or a 4-to-1 or a 10-to-1. Most CBD is a 20-to-1, sometimes 30-to-1, and that means 30 parts CBD, 1 part THC. And so we can have just a little nudge of the THC, but that helps CBD work better. So when we put a THC in, it does increase the efficacy of CBD. And it's very biphasic. So one of the things that we want to explain about that word is that high doses and low doses do opposite things. Taking a milligram or 2 of THC is going to relax you, nourish those CB1 and CB2 receptors directly, and help you to just feel better. Too much THC may cause some paranoia and anxiety. So we want to introduce it slowly, build tolerance, which does happen, so that you are able to take more if you need it. But many people don't need more than just a little bit in the full spectrum hemp products. So it's all good. But and to recap, eat, sleep, relax, forget, protect. That's how important the endocannabinoid system is. And we want to make sure that we have good whole plant medicine so that we can do that.
Yeah. So here we go. For men, if you're out there and you're new, methods of administration, mix and match. So topicals are a great start. You know, a lot of dads out there, you can pull out some topicals we have, you know, lotions, balms, creams, rubs, right?
Yeah.
They're very, very amazing, very local to the area. There's no systemic effect. You can't get high. Transdermal patches are for longer duration. We're ongoing basal dosing, meaning that you get a little bit and they actually do penetrate into the circulatory system because of specific ingredients in it. So those are good. They can be a little bit costly and for patients, hard to find. Exactly. But tinctures are pretty much predominantly what we use for patients. Tinctures, edibles, capsules, gummies, and then sometimes we use inhalation, you know, as well. So there's a lot of different products here. They do a lot of different things. A lot of times what we do for patients is we teach them how to stack, right? We build a toolkit.
It's a toolkit. So
you can see all of these different things. And so when you work with a clinician, we can sit here and we can actually teach you how to build your toolkit for day, afternoon, evening, and how to pair cannabinoids safely with other activities so you can live your best life.
Because it's not just one, right? We need these tinctures on the inside to have our systemic benefits. We need the topicals on the outside to have our pain relief and relaxation of our tissues, and inhalation, you know, when we need to get out of a bind in a pinch, right? So yeah, it's a little bit of everything.
Little bit of everything. So lots of mixing and matching. And that's what we teach. We teach the safe use, and it can keep the cost low, believe it or not. You know, if you have a whole toolkit where you're picking and choosing different products depending upon your needs. And that's what we do is we teach how to listen to your smart body and ask.
And be resourceful.
And be resourceful.
With the tools that you have in the kit.
Exactly. Well, here we go. And then for a lot of new people too. So people that don't have access to THC, don't have access to get to a dispensary, you can purchase CBD. It's legal in all 50 states. I say CBD is for me, or chemo type 3 is for me, which is more CBD than THC, and this can be purchased. And so these types of products have, you know, more CBD than THC. They're from whole plant formulation. They have a lot of the other minor cannabinoids. They're non-impairing and very, very well tolerated. And so this is, again, us building a toolkit.
We can take a patient or a client through the first several months, a half of a year, just using CBD and some of these different mix and match formulations available in the hemp market. So many good medicines are being made. Yep. We want to elevate those and give people agency in figuring out their best suit.
Yep. There we go. Okay. We wouldn't be good nurses if we didn't talk about potential side effects. The big takeaway for all of this is it's all dose dependent. I want you to remember biphasic nature of this plant. Low doses relax, high doses cause anxiety. Low doses mitigate nausea. High doses can make actually someone throw up.
With THC.
With THC in particular.
Yeah, not CBD.
Not CBD. So this is the biphasic nature. So I literally, I have not seen any side effects with patients that have been using guidance that have come
with good clinical care, right? Just is slowly increasing tolerance and finding efficacy. You don't have to have side effects.
No, you don't.
And if you do, like on CBD, a little dizziness, lightheadedness, as somebody's introducing this, sometimes their blood pressure lightens up a little bit and is reduced. Not dramatically, not like you're going to have a fall or pass out, but just that your systemic circulation is a little different, and you're less tight, you're more relaxed, and people don't know how to respond to that.
Well, I have a story. There was a nurse practitioner I was working with. She was getting her PhD. This was years and years ago, and she was new to CBD, and she was extremely anxious, and she was taking such small amounts that I said, you need a little bit more. So literally she was only taking 1 milligram, 2 milligram. I go, listen, you need 15 milligrams. Let's just start with 15. I'm going to be here with you. And she was so used to feeling anxious that it was foreign to her to feel relaxed and calm. She got nervous. She goes, am I high? Am I high? I go, no, you're not high. You're relaxed for the first time in your life.
Yeah. And that's why CBD is psychoactive, right? So that to Sherry's point, we say that CBD is non-impairing, non-psychoactive, but relaxation, stimulating serotonin and dopamine, which CBD does directly. It is all going to help affect mood, but not in a high way.
No.
Right? Not in euphoria or dysphoria or anything like that.
Impairment in a way to impair. Yeah. So really, really important. And then the other thing that's important too is when we look at side effects, we need to consider that the side effect of one patient may be the effect that another patient is looking for. So for example, dry mouth can always be mitigated, for sure. The ALS patients welcomes dry mouth because they're drooling, right? So the patient that has nausea and is muscle wasting and cachexia and can't eat, they welcome the increased appetite and the munchies. The patient that has hypervigilance and difficulty sleeping or have PTSD, they welcome the drowsiness and the sleepiness and the forgetfulness so they can be in the present moment. And then the depressed patient welcomes the euphoria. It's okay to feel good. We all deserve to feel good. And there you go. Look at that one. THC side effect, excessive smiling.
I haven't had any today. I'm just happy.
I have.
Okay.
Safety and dosing.
All right. So what we want to find is that minimum effective dose where you find that sweet spot, just enough, not too much, right? And that's efficacy without side effects, right? So, and it also saves on cost. We want to use just the right amount so that you feel better, but it's not excessive, right? And so we want to start low, go slow, and microdose to mimic the endocannabinoid system. This is going off constantly, right? All day long within microseconds. And we want to have some phytonutrients in supply in our bodies, floating around in the systemic circulation so that they're always available to nudge those cells back to balance. It really is that simple. So if we drip in some tincture, breakfast, lunch, dinner, and bedtime, and we would be using different formulations as well. And we talked about day and night. So that is the way that we want to approach this with patients, using CBD in the day, THC more in the evening, one-to-one formulations as needed to microdose for pain, and then stacking these different options as we explained earlier, and then keeping safe with pharmaceuticals. If we apply some spacing in between the pharmaceutical and the cannabinoids, then we can ensure more safety and less interactions. Because if you think of the digestive tract as as a train track. You want to let the pharmaceuticals go through first and not get stalled at the station before you put CBD in there, because it's all about enzymes and clearing things out of the body. So, and then of course, journal and talk to your provider. Talk to us as your clinicians that you're working with. We're going to give you tracking logs and have the ability to say, 1 to 10, where am I at on my levels of pain, anxiety, memory, focus, joy, mood, sleep, blood pressure, blood sugars. All of these can be affected by cannabinoids. And we want to take you through how to approach wellness and keep you safe and give you good results.
Yes, we do. So shopping for safe CBD.
The Green Nurse approved.
We have been vetting. Listen, we've worked with literally thousands of patients. So we have had to vet products and services.
They're not all good. Don't buy CBD at the gas station.
Yeah, it's expensive, right? Don't go cheap. We have an amazing CBD marketplace. And what we're looking for when we're shopping for safe CBD is we want to make sure that the CBD comes from cannabis or flowering strains of hemp. And then you want to make sure that if it's a CBD isolate, single molecule, broad spectrum, whole plant, -0 THC, or full spectrum. You want to make sure the company is transparent. Do they have a good website? Is their address there? Is there email? Is there customer service and support? And do they offer a nurse line, right? Good manufacturing practices. Are they organic? Are they lab testing for purity, potency, contaminants, residual solvents? And the other important thing is accuracy with labels, right? And potency. You can have a 3,000 milligram tincture and a 300 milligram tincture, and the serving size and the dosing and the amount of milligrams is going to be very, very different. 10 milligrams versus 100 milligrams, right? So it's very important to know. And then if you have help, if you have questions, if you need help, you can call our free nurse line and we can help you to choose a product that is best for you.
970-404-HOPE or 4673.
Hope. And then also I'm going to do another plug, is free 7-page medical cannabis guide. When you go to the website, we have a free guide and you can just sign up for the newsletter and get that free guide as well. All right. What else do we have here? Oh, here we go. Bloom. So happy Father's Day, everyone. Bloom Hemp. Very, very excited to introduce our full-time partnership with bloomhemp.com. Yep. Elizabeth, you want to share the news?
We bought it. We're going to be building Bloom Hemp into our ecosystem. We're providing the programs, the coaching, and now some of the best vetted CBD out there. Bloom is in Colorado. It's USDA organic CBD and other phytocannabinoids. And these guys have always been doing the right thing for the right reasons with the right people and the right plants, really growing in the right way. And so
we're partnering up with them, and we're going to be bringing the biggest formulations for the patients. Truly, Elizabeth has mapped out the most amazing mind map of symptom targeted formulations using clinical protocols based on research and evidence.
Yeah. Right. And so we have something in every category. Beautiful tinctures, the fundamentals in the CBD hemp oil that is just plain. We have the essential line, and now we're going to create a clinical care line that is going to bring in a little bit more that we've been using, that we're used to from some vendors. We want to make Bloom the best of the best. Capsules, gummies, all kinds of balms, salves, and creams, great topicals, isolates, and so much more. So we are just thrilled to be able to partner with these guys and take Bloom into our ecosystem for keeps.
Yes. So if you go to the website, I think I put something in the comments below. They have a bundle pack that is absolutely extremely cost effective.
$25 for the sample pack.
$25. You get a muscle and joint therapy cream, an active care cream, essential calming tincture, essential recovery tincture, essential digestive tincture, 5 energized gummies, and 5 sleep gummies. So this would give you probably 5 to 10 days of really good coverage of using cannabinoids, and you can see what works for you.
Yeah, which products really speak to you? What ones help your body the most? Take a dose, take a full dropper of one of these tinctures, etc., or a gummy, and then an hour later, write down what you notice. What do you feel? And see, if this is your formula. There's so many different ways to use these. And of course, recovery during the day to CBD and CBG and some anti-inflammatory terpenes to get you going. Calming at night, CBD, CBN, and linalool help you sleep well. Okay.
Okay.
I'll be right back.
Right back. Elizabeth just got a patient call. So I'm taking over. Woo! Here we go. Taking over. All right, let's see. I'm going to just go to the next slide and then I will take questions. So we are wrapping this up. We want to offer you the best of the best that's here. So what I want to offer you all too is if you go to holisticcaring.com, I want to invite you into our network. So we have a free network for patients and providers across the globe. It's run by nurses as well as our pharmacist, Charmaine. We have a free introductory to cannabis course, webinars, podcasts, and support. Elizabeth is launching a psychedelic program. It's going to be for 4 continuing education hours. And we've also launched our psychedelic support group. So it's education, support, and integration around the use of psychedelics for microdosing and for those that are taking the bigger trips. It's really important that we take care of our endocannabinoid system. So in the network, we have that free support available. We also have a 7-page medical cannabis guide with a newsletter sign up. On the website, we have a Green Nurse approved marketplace, not just with our favorite Bloom products, but also with other products that we vetted. Really important that patients have, a really nice options for different types of products when they're new to using cannabis as medicine. Patient and professional online educational programs. We do mentoring for clinicians and nurses, and we do consultations and coaching for patients. So we do have a very extreme, robust platform. And of course, our podcast. If you haven't subscribed, please do. We really appreciate your support in helping us to change the paradigm of healthcare. So what I'm going to do is I'm going to close this out really quickly, and I'm going to take a quick peek and see if there's any questions on today's podcast. Hey, Jamie. Hey. All right. Can't wait to try Bloom. Bloom is amazing, right? So this is what we're doing. We're going to teach people. We're planting seeds, and we're going to bloom in health. Truly, really amazing what Elizabeth and I are creating. And we're here to share it with you all because we do truly care. So Elizabeth had to sneak off and take a patient call and because she's been waiting to hear back from this patient. And I just want to thank you all for joining us. Truly remember what it's all about. It is about living your best life and helping others do the same. We'll see you next time.
We're here to educate and empower patients to make choices that are best for them. We're also here to decrease stigma around what it means to feel good and be high. Hence the H for hope, I for inspiration, G for growth, and H for healing. The Green Nurse is a holistic cannabis nurse that teaches on the endocannabinoid system and the safe utilization of cannabis and other progressive tools to help people reach a better quality of life.
I was cannabis agnostic for many, many years. And the more research I did, the more I discovered that cannabis is this amazing medicine.
I was told that I had a 4-stage pancreatic cancer. The doctor really told me he couldn't do anything else. He gave me her name and she called me and she came to my house. She started to give me cannabis. My oncologist was puzzled because he couldn't find the cancer anymore.
All of the learning that we get comes from the Green Nurses Group, comes from their support, comes from their guidance. I trust everything that she says.
Simply meet people where they're at. The plant doesn't, stress to grow, so we don't stress to share it. We're healing people.
Cannabis has been used as a medicine for tens upon thousands of years. Here's the big message. Cannabis needs to be federally legal. We need to have laws that are the same across all 50 states that allow access to anyone and everyone who wants to utilize this powerful medicine.